Welcome everyone. I believe people are still connecting to this webinar, but we can start, I believe. Welcome everyone. Thanks for joining us to this webinar, which comes at a very important time. We will be talking about covering the informal sector and social protection responses to the COVID-19 pandemic in this particular group. Now, covering the informal sector, covering informal workers with social protection programs is, of course, a topic that has been on our minds and part of our work for many of us for years. But during the COVID-19 pandemic, it became much more a focus of attention and much more urgent, as the gaps in the social protection systems were very much in the informal sector, where the economic and social effects were felt the most severely. We will be talking about two recent publications where the co-authors will be joining us to present their key findings. And then we will be looking at two country cases where we have Rwanda and Thailand that will be talking about covering informal sector workers in particular, but also during, in general, but also in particular, what has been going on during the COVID response and what we can learn from that. I believe if we can go to the next slide, we can see our speakers. I can introduce them. I'm not seeing the slides. Then I'll just introduce everyone anyway. I start with myself. My name is Silas Theile. I'm a social protection advisor and will be at GIZ in Germany and will be conducting this webinar with you today. In my day-to-day job, I'm a policy advisor to Germany's Federal Ministry for Economic Cooperation and Development on social protection within the German development policy. The speakers who will be joining us today are Laura Alfers, who is a director of social protection program at WIEGO. She will be sharing from a recent publication that she co-authored with Valentina Barca, within the space cooperation, which many of you, I'm sure, will know. That paper looked at options and opportunities in covering informal sector workers, in particular, with respect to the COVID pandemic. Then Melis Guven will join us and share from a recent World Bank paper that she led. This World Bank paper also looks at covering informal sector workers, at the interaction between social insurance, social assistance, but also at some aspects of behavioral economics. How can nudges and incentives be used? And then on the other hand, the role of digital systems, of data, of delivery systems. How can we build on those? How can we build digital delivery platforms, as this paper calls them, to really interlink social assistance and social insurance and build stronger systems from there. After those two leading presentations, we will have two speakers who will present country cases. Regis Hitimana is the Deputy Director General of the Rwandan Social Security Board. We'll be talking in particular about a long-term savings scheme that has been implemented in Rwanda. We will be sharing some experiences from that program. Then Joanne Sharpe, who is an independent consultant, will be talking about the experience in Thailand, in particular during the COVID pandemic, concerning both social insurance and social assistance, and then looking at some of the aspects of how technology has been used and what maybe were the challenges, what could be learned from the response for the future. We will start with these two presentations, and then the country cases will be presented, and I will post some questions to our four panelists. Please put all of your questions in the chat, because after that we will still have about half an hour for a Q&A session. You can already begin during the presentations to put your questions into the Q&A box. We will be collecting them, and you can also vote on the questions which you would like to see answered on other people's questions. We really want to have an informal conversation in this Q&A session. So please do not be afraid to put your questions into the box. And we'll have enough time, 30 minutes, I think, to really go into some detail and to pull out some considerations that might be very condensed and short in the initial presentation. So if you pick up on anything that you would like to know more about, just put it into the box and we will have some time to talk, I think. And with that, I would like to, I believe, hand over to our first speaker. I don't know which order you had planned. I think we'll just start with Laura. Is that right? And Laura, you will be sharing your presentation from your screen yourself. Thank you. Please go ahead.
Thanks, Silas. And yes, I will start sharing my presentation now. So as Silas said, I'm going to be sharing some findings from a paper written with Valentina Barker for Space. Really, it was a synthesis of existing sort of everything we know to date about the extension of social protection to informal workers, as well as drawing up some of the experiences from the sort of COVID lockdown and social protection responses. I think, first of all, though, it's quite important for us to be clear about who we're talking about. And I think we're talking about informal workers, not just the informal sector, which tends to refer to unregistered enterprises. Informal workers are workers without access to labor or social protection. There are over 2 billion informal workers in the world and over 60% of the global workforce. It's also important to realize there are different types of workers. There are informal waged workers, and we can find informal waged workers in the formal sector. For example, those who work without protections for formal enterprises. In the informal sector, so people working for unregistered, unincorporated enterprises, and in households. So for example, domestic workers who have no labor and social protection. And then we get to the kinds of informal workers who really challenge our policy models, who are the informal self-employed workers and who certainly make up the bulk of the labor force in low-income countries. And here we have employers who tend to be the better off sector of the informal economy, self-employed and employing others. But they are also the minority. About 3% fall into this category of the informal workforce globally. And then we have own account self-employed, so self-employed but do not employ others, working on their own account, much more vulnerable status in employment, as well as very, very vulnerable groups like contributing family workers, in which we see many women concentrated. Also, there is a lot of heterogeneity in the informal economy, right? So we've talked about that there are a range of statuses in employment: self-employed, wage-employed, employer, own account worker. And these statuses in employment are correlated with earnings. So as you can see, employers sit at the top and unpaid family workers sit at the bottom. The risk of poverty increases as you go down that triangle. Earnings and earnings increase as you go up the triangle. Another aspect is the gender segmentation. So just as we see in the formal economy, amongst formal workers, there's a gender segmentation, the same in the informal economy. So you see that mainly men occupy the top sort of rung of the informal economy, whereas women tend to be concentrated in the more vulnerable forms of employment. This heterogeneity is important for policy, right? Because it means that there's a huge group of people who are not just one lump or one mass of people who are the same. So when we say we're trying to extend social protection to informal workers, we've got to realize that we mean a lot of different people doing many different things with different earning levels and different economic statuses. And so that is why it's not just one solution to the extension of social protection. It's more like a jigsaw puzzle. And I think Valentina has done an excellent job here trying to put the pieces of the jigsaw together. What does a comprehensive social protection system look like for informal workers? It must include insurance, social insurance, not only because through insurance we get higher level benefits, but often because insurance systems are designed with working people in mind, right? We get benefits that working people need, unemployment insurance, etc., which may not come through the assistance system. And so it's important that these kinds of systems are extended to informal workers. Social assistance as well is obviously important. If we look at workers such as contributing family workers who may not actually be earning an income, their capacity to contribute to insurance schemes will always be limited. And that is why we need social assistance to step in and make sure those workers are also covered. And then also not to forget that ultimately, those sort of more traditional forms of social protection must work hand in hand with measures to improve incomes in the informal economy. We can talk about extending insurances and savings to informal workers, but at the same time, we need to be improving income so that contributory capacity and capacity to save are increased. So economic inclusion, business support, preferential access to markets, supportive regulations and infrastructure for informal workers is all a really important part of the puzzle. And particularly for women who tend to be in the most vulnerable forms of employment, we also need to think about complementary public services. We all saw what childcare did for women's employment amongst everybody in the global north and the global south. And informal workers suffer from this similarly. So provision of childcare services, universal health coverage, labor protections to improve working conditions are all part of this package, which, as Valentina has indicated here, also requires better data on the informal workforce. There's still too many countries where the informal workforce remains invisible because the data isn't good enough, as well as guaranteeing transparency, accountability, and social dialogue, with participation and inclusion of informal workers themselves, many of whom are in fact organized and are willing to represent their interests in policy making. So what lessons can we draw about informal workers and social protection from what we saw during COVID? I mean, there were many lessons. I've just picked out 4 of them that I think are going to shape where we go from here. Obviously, we saw that systems that better supported people to tackle life cycle idiosyncratic shocks, so systems with higher coverage across the life cycle for more people and on-demand coverage, were also better at supporting during COVID, which was a covariate shock, right? So those countries where the systems were more institutionalized and covered more people were also able to provide the relief more quickly to more people, including informal workers, for example, Brazil. We also saw that many informal workers are still invisible in data systems. So many countries were saying, okay, we want to extend some kind of relief to informal workers. Where do we find them? So we had, do we find them in the municipal databases? Do we work with organizations of informal workers to get their databases of members? How do we identify these people? And I think that it has led to, we see in India now, there's a huge registration effort taking place to try and get informal workers registered on the systems. So I think that idea of making informal workers more visible within state systems will be important. And then, as we know, and I'm sure Melis will pick up on this, a lot of the responses were digital, involved some element of digitization, whether it was, the use of e-money or having a bank account or, being able to access the internet and smartphones. And I think from the perspective of informal workers, that often highlighted the real digital divide that still exists in many places. So the issue of digital inclusion and is going to be something that shapes the issue going forward. And then finally, inclusion, accountability, and empowerment are critical aspects of the social protection system. Working at WIEGO, where we work very closely with grassroots organizations of informal workers, one of the things we noticed was that where organizations of informal workers had a well-established trusting relationship with the government, i.e. they had been involved in policy reform and, the government knew them and they know the government, they were actually able to help come on board and really help with the extension of relief. And because that relationship already existed, right? I think we also saw that in Kerala in India, and we definitely saw it in Thailand as well, where a sort of whole of society approach to the relief effort was more possible because of this relationship that had been built up between the organizations and the government in their social protection systems. So it is to say this idea of inclusion can have real benefits to crisis response as well. So what are some of the key challenges? I think maybe they've, already been mentioned. We have to think about how we can get social assistance to reach more people. Currently, so much social assistance has such a low eligibility threshold that too many informal workers are cut off from it. Making insurance schemes more accessible and affordable whilst maintaining adequate benefits is another key challenge of the puzzle. So much in the development and social protection sphere, so much effort and energy has gone into social assistance, and the same effort and energy, perhaps this will change now, has not gone into looking at insurance to the same extent. And I think perhaps it's because it's not been seen as an issue of poverty. But if we're going to cover the informal economy or informal workers, it's got to be part of the equation, and we need to start looking at the innovations that allow us to get there. And I think it's a hard balance. It's a hard balance because many informal workers don't have a lot of money to put towards savings and contributions, and how you then create adequate benefits for them out of that is a really big question. And then the issue of ensuring better integration between the two, so that all workers are covered, whether formally and informally employed. People moving in and out of formality. Systems need to be able to cope with that. And then just onto my last slide, we reviewed some of the issues. Some of the examples and experiences we've seen in making insurance schemes more accessible to informal workers. And there were four sort of options that we identified. The one was around solidarity financing. So again, this issue of considering that many workers in the informal economy have low incomes that aren't going to provide them with sufficient benefits in future, who else has to step in to help ensure that what they are able to save or put towards insurance actually provides them with meaningful benefits. So we see that, with contributions from the state, matching contributions, lowering the contribution amount, care credits for women who have to step out of paid work when caring for children, sometimes contributions from those who profit from the work of informal workers but who are not employers. And sometimes also redistribution within schemes, so taking contributions from formal sector workers and using it to cross-subsidize to informal workers. Then options around facilitating, simplifying, and incentivizing access, making registration more accessible and easier. If you're a self-employed informal worker, spending time trying to register with a scheme is not going to be something that makes you want to join up. So, designing schemes in that way and designing benefits to meet needs is particularly important. Informal workers may have short and long-term needs, and they'd like benefits that speak to both of those. Also, with contributory schemes, if you're asking people to give in money, the questions of transparency, accountability, and social dialogue are also important. There has to be this trust relationship if people are going to put money into a contributory scheme. And then also considering how to extend supportive legislation to regulate informal employment. Sometimes it is possible to extend legislation to regulate informal employment. Like we've seen that with domestic workers in Latin America, that, labor protections have been extended to them. And this is one way of ensuring that social protection is part of what they get. So this is not an impossibility. It can happen as well, and is one of the options. I do have some country examples, but I think I will leave those for the question and answer session. And of course, you're always welcome to go and look at the paper itself. Thanks.
Yeah, thank you so much, Laura. That was a really great overview, and I think a lot of food for thought already. I think it's really interesting how you spoke to the sort of the great divide between social insurance and social assistance, where you have countries with strong social insurance and social assistance systems with routine systems in place that react almost automatically during covariate shocks or can be easily adjusted. And then you have a large part of the global population that is really cut off from that. And there are these limitations in trying to extend social assistance, with informal workers not being visible to these data systems, not being included. And then I think really the discussion becomes very interesting when we talk about what can we do in terms of social insurance. How can you really make this more accessible, strike this balance that you mentioned between adequate benefits and limited ability to contribute. And then of course, sort of among all of these innovations, sort of how do we get to this long-term objective of regulating informal employment as well? And how does that fit into the picture? I think we'll have a lot of discussion on that. And with that, I'll pass over to Melis, who will be sharing from the publication that the World Bank published, I believe, just at the end of last year on social protection for the informal economy. Please go ahead.
Yes, thank you, Silas, and hello everyone for joining us today. And I want to also thank the organizers for giving me the opportunity to share findings of our recent publication. I'll be sharing the main findings, but just a little bit of a background on the report before I start my presentation. So as we prepared this report, we focused on the entire informal economy to present how different social protection instruments would respond to the needs of these diverse groups. We then provide a deep dive on social protection instruments for the missing middle, or the missed middle, as we call them in this report. And while this report on social protection for the informal economy is on Africa, you will agree with me that the challenges in the informal economy are not specific, obviously, to Africa, and they hold true for most developing countries with a large informal economy. Next slide, please. And here is this fantastic team behind this report. This was really a collective effort within the World Bank and with our counterparts across the globe. Next, please. So why is social protection for the informal economy so important in Africa? Because informal economy is so large in the region. It's the main source of employment, and in most countries, in some countries, more than 90% of employment, although there is a variation across the region, and more women are employed in the informal economy than men, and women are more vulnerable because they tend to be in more precarious jobs. And the informal economy faces a host of development challenges. They have low human capital indicators, low productivity, and they have low and irregular earnings, and therefore they are more susceptible to shocks as well. Next, please. So despite these vulnerabilities, though, informal workers are not typically covered by social protection programs. Most countries in the region have safety net programs, but their coverage is low, focusing on rural areas with little or no urban penetration. Coverage of the existing social insurance programs is also limited to the small formal sector, which is about 10% of the working age population on average. And the reason being, these existing social insurance programs do not necessarily respond to the needs of the informal economy workers. They require regular contributions and require a formal employer-employee contract, which the informal workers do not have, obviously. Next, please. And And as we all know, the pandemic highlighted all these vulnerabilities of the informal sector, particularly in urban areas, in Africa, but also elsewhere. And as you know, globally, social protection played a critical role in responding to COVID-19. And countries that invested in social protection systems prior were able to respond better. And the pandemic prompted innovations, but also highlighted gaps in resilience. And with COVID-19, governments are more than ever aware of the need to develop and implement new methods to extend coverage to the informal economy. Next, please. And I want to one more time acknowledge the investments and progress on social protection in the region over the years. And these investments need to increasingly continue, such as improving the coverage of social registries or improving the coverage and quality of ID systems to address the remaining gaps in social protection systems. Next, please. But beyond this, what can countries do in thinking about extending social protection coverage to the informal economy? And understanding the characteristics of households in the informal economy could be a good first step to do this. And to help countries do this, we developed a methodology to group households according to their ability to cope with shocks, and we used household surveys to do this. And according to this methodology, between households below the poverty line at one end of the income spectrum and formal households at the other hand are the non-poor informal households. Non-poor informal households are not eligible for social safety nets as they are not poor enough in normal times. They are also not covered by the formal sector social insurance schemes either. And this is why we call them the missed middle of social protection in our report. The missed middle largely remains unobservable by governments, and therefore they are difficult to reach and deploy support in case of major shocks like the pandemic. And they are a large group. We found that the missed middle to range between 32 to about 74% of all households in the 6 countries where we carried out this analysis. Next, please. And zooming in further on the missed middle, we see that the missed middle in itself is also diverse. Some are resilient with some ability to save long term, while others are more vulnerable and may need fiscal incentives to save. What looks promising is that a significant share of the missed middle is resilient to shocks and have some ability to save. And all of these, we believe, are important considerations for policymakers and practitioners in social protection programming. Next, please. Now, given these distinct characteristics of the informal economy, a suite of social protection instruments would be needed. So along with efforts to expand coverage of safety nets, economic inclusion programs, and productivity enhancing measures would be needed as part of the overall poverty reduction efforts, and also to increase returns to labor, to increase productivity. Beyond these, however, developing innovative social protection instruments to meet the needs of the diverse missed middle would be needed, we think. And I will go deeper to talk about these innovative instruments during the rest of the presentation. Next, please. Before I go deeper on these instruments, though, I would like to take a minute to talk about fiscal space and universal social protection. We believe that universal social protection should be the ultimate goal for countries. And how countries make progress towards this goal, including covering the large middle, will obviously vary based on their unique circumstances. An important consideration here for developing countries, and including countries in Africa, is the limited fiscal resources to finance universal basic social insurance. Therefore, a progressive approach can be adopted to lay the foundations for universal social insurance, to be practical. And to be more specific, an option to consider as a first step could be to offer voluntary saving schemes to informal workers to access services and allow them to save. And this scheme should not rely on a formal employee relationship, as obviously informal workers lack these formal contracts. And one of the reasons why they are also out of existing social insurance schemes. And such a scheme that we are proposing could potentially be scaled up to be mandatory and universal when the enabling conditions, both fiscal and administrative conditions, are in place in the future. Next, please. And these social insurance or saving schemes for the middle could be deployed cost effectively at the operational level, leveraging technology. And to ensure continuum of social protection at the operation level, these informal sector social insurance digital platforms can be built on top of ID systems, and they can be made interoperable with social registries and payment systems. And here in the slide, we share a visual presentation of what this could look like. Next, please. So also, when we talk about designing schemes with the primary objective to increase coverage of those in the informal economy, it's really important to look at the challenges they face and then consider if and how they can be addressed through design considerations in these schemes that we are proposing. But in addition to these challenges, we also see some opportunities when it comes to this group. For example, they tend to be organized around informal sector associations or cooperatives, and they are increasingly adopting digital financial services. Next slide, please. So moving away from design considerations, if we look at what makes these schemes viable, then we find that scalability is critically important. Therefore, providing incentives and nudges which can promote uptake and ensure persistency of savings is important. And these incentives could include matching contributions, flexibility in withdrawals from savings, or bundling with other benefits such as health insurance. And these incentives are being employed in some countries. And to ensure that this is not a huge fiscal burden for these schemes, it's possible to determine who is eligible for these fiscal incentives through the social registries or social assistance system. And therefore, these incentives, fiscal incentives, we believe should be available for the more vulnerable missing middle, not to the entire, but to the more vulnerable missing middle. Next, please. Now, in addition to monetary incentives, behavioral nudges can also be employed to improve uptake and persistency in savings. And in the report, in our publication, we present the customer journey in terms of savings and the challenges that these groups may face in saving, and how these could be addressed. We also talk about some of these behavioral nudges in detail in the report in case of interest. Next, please. If we look at the enabling environment that is necessary for these voluntary savings schemes, then robust and reliable identification systems and payment infrastructure are what instantly come to mind as the foundational blocks needed to make these schemes efficient, cost-effective, and these would also support the reliability of these schemes. Investment in these systems need to continue, and social protection schemes or these voluntary savings schemes can leverage these systems. Next, please. Institutional arrangements for these social insurance schemes that we are proposing is another area that policymakers and practitioners are advised to focus on, because a clear understanding of processes, roles, and responsibilities will ensure smooth functioning of the scheme and therefore help build trust that Laura was also talking about. Next, please. And when it comes to investment of accumulated savings by the administrator, which we think is very important because we really don't want savings of these vulnerable groups should not be wiped out. So it's really important to design an appropriate investment approach that enables real return to participants over time. And it's also important to highlight here that the investment approach for these schemes is strongly linked to the quality of the governance of the scheme. Next, please. And a legitimate and a common question we often hear from our government counterparts, development partners, and colleagues is around the financial viability of these schemes for informal workers. To put it simply, what one wants to know is when the scheme will break even and what is the funding amount needed before it breaks even, meaning the revenues are higher than expenditures. So to address this need, we at the World Bank developed this scheme viability assessment tool, which now enables our client countries to project the cash flows of a voluntary savings scheme and also carry out scenario analysis. Here we present some of the outputs from this tool, but there are many other outputs that one can customize and produce. Next, please. So in summary, I'd like to leave you with 10 takeaways of our publication. First, many in the middle have ability to save. Second, efforts to integrate social insurance and social assistance through digital platforms can have positive spillover effects, such as facilitating graduation of social assistance beneficiaries, creating shock responsive systems, and increasing financial inclusion. Employing digital systems, especially mobile money, can reduce operating costs and make saving more accessible. Trust in the scheme is key to take up. Incentives and bundling of services can boost take-up rates. Scale and cost effectiveness is critical for a scheme to be viable. Because we really don't want these schemes to be a fiscal burden like the existing formal sector social insurance schemes, like in most countries around the globe. Investing in communication strategies using aggregators, such as the informal sector worker associations or cooperatives, and testing behavioral nudges are essential for success. Keeping the design of the scheme simple should be one of the key considerations, given the financial literacy levels of the target group. And pilot testing the scheme before a national launch is recommended to reflect lessons learned in the national scale-up. And setting setting smart goals and reviewing them on a regular basis is critical to monitor progress in the scheme and take necessary actions. And this report is available online if you would like to take a look at these issues in more detail. We also published a blog series for each chapter of the report, which are also available online in English and French. I'll stop there. Thank you. Over to you, Silas.
Thank you so much. I think that was already very interesting. Before we go on, just because I'm seeing some questions, just a short matter of housekeeping. The presentations will be available online afterwards. We will be sharing them. The webinar is also being recorded. I would also like to remind everyone to please put your questions into the Q&A box so that other people can also vote on them, so we can get a sense of which questions we should answer first and in most detail. I think, Melis, what you just shared is really interesting as a sort of very practical way forward in this issue that you mentioned. How do we act under fiscal constraints? How do we capture potential contributions from non-poor informal workers in particular? And I think what you presented in terms of the long-term savings accounts is a very sort of different approach than to what Laura previously presented with how do we make traditional social insurance, solidarity-based risk-sharing insurance, how do we make that more attractive? So I think that will really lead to some interesting discussion, but let's really go into the practical side after the framing. And I would then hand over first to Regis Hitimana. He is responsible within the government of Rwanda for working on one of the long-term savings accounts or individual savings account schemes that really reflects a lot of what Melis was just talking about. The scheme, which is called, sorry, I don't want to make a mistake here, EJOHESA. I believe that you can talk more about it, which is a long-term savings account scheme that the government subsidizes in terms of contribution matching. If you could just give us a short introduction of what this scheme is, how it works, where you see the potentials and the challenges, the innovations, and what this scheme could maybe grow into, and how it links with other social assistance schemes in particular. I think that would be really interesting.
Thank you very much, Silas, and thank you, participants. I'm Regis Hitimana, and part of what I do, I also oversee management of this interesting scheme. We call it a long-term savings scheme. EJOHESA is a Rwandan name that means the bright future. It's a new scheme. It's recently we celebrated 3 years. But when you look at the achievement, I think you might think that it's more than a decade of existence, which shows the excitement that the Rwandans have taken this initiative. It is a long-term savings scheme that targets the informal sector. It was initiated after a realization that only 8% of the working population was covered by any social protection, and the rest of 92% didn't have any option, including the low income and the middle that Melis was referring to. Much as the low income were benefiting from social protection support, but there were no provision to save for the future, which means that means a perpetuation of needing for assistance even at old age. So that's why the government have established this scheme in order to complement the formal sector scheme. It is open for everyone, Rwandan and foreigner living in Rwanda. It is mandatory, and the ID is the main reference number. It's your account. and we benefited from the existence of that digital ID system that has a database which links the person to the account on Regis, and you can create your account with your phone without. It was really digitalized from the beginning, which is I think an enabler that allowed that speed take up of the scheme. So in a nutshell, that's what the scheme is. We have seen a lot of excitement, as I was saying, and we can discuss more about the incentives that also are behind that rapid take-up of the scheme. But answering to your question, I think that's what I can say for now. Over. Thanks.
I maybe put some very quick questions to you before we go on to the Thailand case. And please, if anyone else has questions, put them into the QA box as well. You mentioned that there are some incentives. I understand there are matching contributions to the savings, but there are also different kinds of incentives. So what does that mean in practice? What does that look like? And why are they so successful in extending coverage very rapidly?
Yes, thank you, Silas. So this being a long-term saving scheme, already saving is a very difficult exercise for everyone. Putting part of your income and foregoing your immediate needs in order to save for your future. And other formal sector, the employers help them to do so, of course, according to existing regulations. So it is not easy to convince someone to start saving for 10, 20, 30, 40 years ahead. That's why the government have thought of incentives in the beginning of the scheme. And one of them, as you said, is matching contribution, which is a scheme that government has created. You know that first it is based on socioeconomic categorization. We have a household registry where everyone is recorded and is given a status from poor to rich. And every category, we have 4 categories. Every category has a target. When you reach that target in a year, government will give you a top-up. The lowest category will have 100%. They are supposed to pay $15 a year. When you reach that, government will give you another 15%. Second category, $18, they will give you half of it. So that's the main incentive, which I think when you look at the savings pattern, you see that everyone is trying at least to reach that level where they will get government subsidies, which makes us think that without it, probably people will be saving less or not even joining the scheme, if I may say. So that's one. Another one is life insurance and funeral insurance. I think Melis have referred to it. So everyone, regardless of which category you belong to, socioeconomic category, when you have completed your target, annual target, you will be subscribed to life insurance and funeral insurance. So those are some of the incentives that people can see before reaching the old age. So you can see your neighbor when they had that unfortunate event in the family. You will see that there will be that quick provision of those benefits, and that at least it's something people can see with their hands before they reach the retirement age. There are other incentives that are prescribed in the law, but because the scheme is so young, we have not reached the time where people start enjoying them, because there is a minimum saving that secures your monthly pension benefits. When you surpass that, it's around $4,000 US, if I put it in dollars. After anything beyond that, you can start receiving a percentage of it for housing, for education of your children, as for collateral in the bank. So because majority of our members have not reached that level, we have not seen people requesting to access those, but it's something that we we explain when we do mobilization that after you secure your minimum to receive that we allow you from age 55 to receive monthly benefits, then you can keep saving because beyond that you can receive 40% of it for your housing, for your education, or for as a collateral in the bank. So I think those are also other incentives which I think keep people saving in the scheme. Over.
Thanks for that. That is very interesting. I already see people asking in the chat for some written information on that scheme, on some background information. So if you have anything that you could share, I think people are very interested to learn more details. And with that, I'll hand over to Joanne Sharpe, who will be talking a bit about Thailand as a case example. In terms of the COVID response, there was both social insurance and social assistance responses that very much hinged on the availability of ID systems and payment systems. And I think she'll give us some reflections on that. Please.
Thank you, Silas. Thank you, Laura, Melis, and Regis for your presentations as well. It's been really interesting. Just to give a bit of context on the situation for informal workers in Thailand. So, as is the case in many countries, more than half of workers in Thailand are informal. So there have been voluntary social security schemes for informal workers that informal workers can opt into since about 2015. That's an example of the kind of solidarity financing that Laura was talking about, where you see various levels of payment from that you can opt into these schemes at different levels of payment. The government makes a co-contribution, and depending on the sort of tier at which you enter, you're eligible for different kinds of benefits through the life of the scheme. But in 2019, and indeed as the pandemic kicked off in 2020, only about 15% of informal workers in Thailand were registered under the formal social security scheme. And I suppose what's important to emphasise as well is that even though, as I mentioned, there are several tiers of insurance coverage and they sort of confer different benefits, none of those benefits included unemployment insurance. So that when the pandemic hit and a lot of informal workers were affected by lockdowns, the economic restrictions and those sorts of things, none of those people were protected by unemployment insurance. And it's actually an interesting case because, as you know, we haven't really mentioned the formal sector much for obvious reasons, but in Thailand, the percentage of people that were covered by the formal insurance scheme actually really benefited. The formal social insurance scheme really protected, really stabilised millions of Thais during that period. So the kind of the mismatch there in terms of what was offered through what is actually the same, it's the same social security scheme, but with different conditions for different categories of worker was quite stark. But, you know, recognising, of course, that this gap existed in terms of the missing middle or the missing majority for informal workers in Thailand, the government very rapidly put in place an emergency scheme, which is called Rao Mai Tin Bun, which means no one is left behind, or we will leave no one behind. That was 5,000 baht per month for 3 months, and that was in the immediate first wave of coronavirus in 2020. It was extended later in the sort of last quarter of that year as well. So I'll come to that in a minute, but it was, what to say about that? Taking a step back, one of the interesting features of Thailand is that looking at the sort of overall population coverage of social assistance, there's actually very widespread coverage of social assistance, certainly amongst key groups in Thailand. So, you know, elderly people, you know, 80% of people over the age of 60 are drawing on a tax finance non-contributory pension. About 30% of children under the age of, I think it's 6, receive child benefits. There's a sort of poverty safety net for poor families that reaches about 28% of the population. So, you know, when we look at that definition of informal workers as the people who are, you know, not poor enough, or for whatever reason not receiving the social assistance, but who are also missing out on the social insurance. It's an interesting picture here, because even though there would be informal workers, for example, whose elderly parents actually do receive social assistance of some form, or informal workers perhaps whose children are receiving child benefits in different forms. I'll come back to that. But nevertheless, there was this kind of recognition that there was this particular cohort very much of individuals that was drastically affected and needed support. So that emergency scheme was initially envisaged as that it would reach about 3 million workers. It ended up reaching 15 million workers, and very quickly as well. It also at that time was extended to farmers, which is an interesting, farmers are also a category of informal worker, I guess, depending on how you look at it. In Thailand, the agricultural sector was reeling from a major drought, the worst drought in 40 years as well. So social assistance was extended both to informal workers in sort of urban settings, but also in rural settings, just as a kind of interesting detail. The way this worked was, it was very, it's sort of straightforward. Basically, an online portal was opened and people were expected to go online and register. So it was very much an opt-in process. This works because Thailand has very high national identification coverage. It's almost 100% of Thais hold the national ID, and that's a digitized system as well. Also, a very high percentage of Thai people are linked already to e-payment and payments through their mobile phones and banks through a system called Prompt Pay, which had already been well socialized, was already been used to deliver social assistance, but also kind of just widely used in society. And so what in kind of registering, really the main criteria was, are you a holder of this national ID? And are you a recipient of another scheme? And so that's where the interesting back end came in, where as people were registering for this assistance, their ID numbers were being cross-checked against that database of regular social assistance holders. I should say that data is actually very fragmented, so would have been quite a challenging process. It doesn't all exist in a single social registry. It exists in a range of different databases held by different ministries. Nevertheless, there was a big effort to cross-check to ensure that people applying are not also receiving other forms of assistance. And of course, it was cross-checked against the Social Security register to ensure that they were also not covered by formal social insurance. And nevertheless, even through that process, they were able to establish that there were 15 million workers that required assistance. Of course, that reliance on that very simple e-portal, it's really very simple interface. Nevertheless, that creates challenges around access. And as I think Laura's mentioned, there was a real effort by civil society organisations like HomeNet Thailand, which represents home workers, and other groups within the Federation of Informal Workers, I think played a really key role in helping their members to get online and get this done. So it's easy to kind of, for someone like me to say, oh, it's actually really simple. All you needed was this, that, and the other thing. But in fact, that facilitation was required, and it did occur. I think the other thing that was interesting about the process of registration is that there was initially, I think, back in early March 2020, I think it's not unreasonable to say that the government of Thailand was not expecting the crisis to perhaps be on the scale that it became. There was a lot of initial confusion around eligibility. People were told they weren't eligible for benefits because their name had appeared in another database somewhere, and a lot of concern where that people felt that wasn't the case. And particularly around the farming, the benefits for farmers, it did get rather confused and was rather fraught. But ultimately, again, sort of most of that out and managed to pay 15 million people rapidly. So by the end of July 2020, those payments had been made, along with, as I say, so there's this new scheme for informal workers, or that just kind of missing middle. There were also vertical expansions made to the programs I mentioned before, so the social pension, the programs for children, the social safety net recipients and so on. Overall, we've estimated that Thailand's response, that's kind of the whole thing, reached about 30 million individuals in up to 80% of households. So it was a really comprehensive response. And surveys by WIEGO and also the Asia Foundation here confirmed that informal workers did receive benefits by and large, although there were some pretty key categories of people who missed out, particularly informal or illegal migrants. They were probably the notable exception of people who are unable to register for these schemes. And I mean, noting that the poverty line in Thailand is already pretty low, nevertheless, it's been estimated that the kind of aggregate response meant that poverty did not increase in 2020. There's a few things I just wanted to add to that. That was kind of the 2020 story, which we present in a paper which I can share in the link, which was just a kind of comprehensive, an assessment overall of Thailand's social protection systems and labour market systems, including the COVID response. It's been really interesting here in Thailand to kind of see what has evolved from this. I was really struck last year as the Delta wave came through in kind of July, so July 2021. For those who are not familiar with Thailand, Thailand initially was very successful in suppressing coronavirus in late 2020, and the economy opened up to a degree. But so when the sort of Delta wave came through the middle, it felt that wave really felt like a wave, and there was suddenly a lot of closures again. At that time, the government took quite a different approach to informal workers, which was they said, if you're an informal worker and you register for the voluntary social security scheme for informal workers, we will make emergency payments eligible to you now. So they really, instead of in the first wave, we saw everybody just being provided these funds, in a very rapid and effective way. In the second wave, it was contingent on actually joining this formal program. And I saw something very recently, which we need to look at this actually, but that suggested that actually 3 million, the National Social Security Fund had received 3 million new enrolments through that process, as people were told, look, if you want help, you have to join the scheme. That would actually represent a doubling of that 15% that I mentioned back in 2019. So it's quite striking. It does potentially represent quite a big jump in that membership. Of course, the huge question will be whether people will actually maintain contributions and not just become kind of dormant in that system, whether it will lead to kind of longer term participation. Nobody really knows that yet. And yet there's a real opportunity there, which I think is really interesting to consider and certainly to watch. The last two things I just wanted to say quickly were, it's really striking in Thailand, and being in Thailand through this whole period, Thailand could have done this in a number of ways, and it's interesting to think that, in fact, this country did have options. As I mentioned, kind of even regular social assistance coverage is generally high. So it's actually 72% of people, this is prior to the pandemic, in Thailand, 72% of people live in a household where somebody is receiving some form of social assistance, and that goes up to 93% of poor households. So, somebody, whether it's your aging parents or your young children, or, somebody is part of one of these schemes somewhere. So, it's interesting to consider that Thailand probably could have just done a big vertical expansion on all of those programs and probably achieved quite good household level coverage. But it obviously wanted that individual level coverage, and just the subtle distinctions between households and individuals there, and how that kind of plays out is kind of interesting. The other thing that is interesting about Thailand is it's actually most famous perhaps for its approach to universal health coverage. And we think in our paper, and I think a lot of people comment, that the example of how Thailand has achieved universal health coverage is really interesting to consider when you think about informal workers as well. So in Thailand, it's basically, if it's kind of, so as I say, it actually does more or less have universal health coverage. You're either covered by private insurance, private health insurance, not very many people, a small percentage. Then if you're a member of the National Social Security Scheme, there's a partner National Health Security Scheme. So basically the formal sector is covered by its own particular scheme. And then everybody else, and they just, you know, it really is just anybody who's not covered by other schemes can access free universal health coverage. Can access free healthcare through, it's not exactly insurance, but it's not exactly socialized medicine either, it's sort of a mix. So, you know, it's interesting to consider that Thailand could have taken a similar approach to this when it actually came to the corona crisis as well. It could have said, well, we know who's in the formal sector and we know that everybody else needs help, so everyone's in, you know, and that's kind of eventually what happened, but sort of not exactly how it was designed. But I do think that, you know, when we think about identifying who is missing and what data exists and what registries are available, Thailand presents an interesting case study where there are actually a lot of really interesting and useful data available, and a lot of different ways that sort of comprehensive coverage can be achieved. It, you know, it really just does come down to financing and incentives, and also benefit levels, which are an important conversation point here. I'll leave it there. Thank you very much.
Thank you very much. I think this ties in very well with what we were talking about before with the Rwandan case and also Melis' presentation on incentives. I think the incentives that you described in Thailand look certainly very different than, for example, in the case in Rwanda. But the common thread here is that you need to show some additional, either very tangible and immediate benefit, or some longer term benefit. If I contribute this year to my annual target, as in Rwanda, I get a government top-up subsidy. I think that's very interesting and something, no matter what the scheme might look like. And in particular, I think that's something very important to keep in mind, to really think from this behavioral side of things. I'd like to ease us into the Q&A, and we've already had quite a few questions submitted in the box. Now, some of them were already, or many of them already answered in writing in the box, but I think since we have the time and since we have people available here, it wouldn't be entirely wrong to really put them to the panel again, at least some of them that were the most upvoted, because I think some others in the panel might want to answer as well. I think we have some questions that were among the most upvoted on the entire sort of the idea around voluntary savings schemes. I think that would be interesting to just put to the panel. Let me just summarize the questions that were put forward. We had questions on, our savings schemes, can they provide adequate benefits when funds that are invested might have high administrative costs in terms of investment management fees that might eat into the long-term returns. Then we have the question of what is the role of savings essentially as compared to social insurance? Can they be, or the statement, they are not a substitute for insurance because they don't guarantee income security or provide protection. They only essentially provide what you put in. There's also, I think, an interesting question for public policy in terms of what should be the role of the public sector in the balance between consumption smoothing and risk pooling. So where do we regulate voluntary individual savings, and where do we mandate risk pooling and risk sharing? But I think those are some very fundamental questions that need to be carefully considered. So the question then that was in the chat was, what is the World Bank's strategy to ensure insurance in addition to savings? We also had some questions around the data. Is it sort of the question, do informal workers really do have this capacity to save, or is this no longer true, in particular with increasing household debt levels? So a lot of questions around that. And I know that these questions were posed to Melis, but I'm sure that others on the panel would also have some inputs on sort of the role of savings schemes from Rwanda. But I think also, Laura, you talked about in your presentation about solidarity financing and why that is important, which also feeds into that discussion. So I would just maybe first put it to Melis because you were addressed in the questions, but then please, the other panelists, just jump in as you see fit. Thanks.
Thank you. Thanks, Silas, and thanks everyone for the questions. I tried to answer them in the chat, but let me also try to repeat my answers verbally. I think on the question of whether whether the fact that the operational and investment management costs of these schemes could be high and wipe out savings of the informal sector is a very valid one. And this is why we are recommending quite a few things around this. The first one being certainly the scalability, because the more the merrier, the more people come into these schemes, the more viable they will be, and they will break even. And obviously there is a need to continuously monitor and pay attention to some of the indicators. And one could do this through more regular and frequent monitoring, but also using the kind of models that I presented, the viability assessment model, and we did actually apply this in Rwanda with Regis and team. This would then show where the scheme is going, where the operational costs are, and this includes incentives as well. So constant monitoring and evaluation is of course key to ensure the viability of these schemes. So I think in terms of the role of a state and the risk pooling and all, obviously this doesn't necessarily replace the risk pooling approach. But then it's a very good way and a practical way to start building the foundations of these risk pooling schemes. So by offering an attractive instrument on a voluntary basis, the government can then connect people to the administrative registries and other systems to eventually enforce a mandate for risk pooling. When the fiscal and administrative enabling conditions are in place. But with a large informal economy and a majority of working, people working in this economy, starting with voluntary instruments shows the most promise. So this is what I could say. On the capacity to save, so it's very clear that the savings capacity of these groups likely decrease because of the pandemic. But then we also see that, and Regis could allude to it as well, in Rwanda, but also in India, the coverage of these schemes have increased during the pandemic. And the reason, one reason I see for this is that I think people realize that governments do not have the fiscal resources or even the administrative capacity to respond in case of a major shock like the pandemic. So then maybe their thinking is, okay, let me do whatever I can to save. And then it's also, possible to then rely on these savings in case of a shock, because some schemes do allow for short-term access to savings, or in the future. So that's how I would respond to these questions. Thank you.
Laura, you want to go, please?
Thank you. Sorry. Yeah, I mean, I agree with Melis that there's been an increased awareness of savings. I mean, certainly amongst the groups we work with, there is a feeling, organizations of informal workers, there certainly is a feeling like we need to save. And so we've recently released a report on worker cooperatives and workers' mutuals, which are starting up in the wake of COVID. At the same time, though, I mean, I do feel like the ability to save has been significantly eroded. Our own small monitoring study, it's just the levels of debt informal workers find themselves in now is going to take years for many of them to get out of that. And you do wonder to the extent to which they're going to be able to save. I think, though, I mean, as the discussion has pointed out, savings are important, and I'm fully on board with that. Social protection is important, and we all know that, and I think everybody agrees with that. And I think it's important for us to realize they're not entirely the same thing. And I guess my problem is that, what if we get stuck at the starting point and never move on? Voluntary savings schemes become the answer to extending social protection to informal workers, and we never get further than that. Because, I mean, we've seen this. We've seen social insurance schemes that never go beyond formal workers. We'll start with the formal workers and then we'll go to the informal workers, and it's never, okay, it's starting to happen, but for a long time, it just never moved. What if we get stuck on the voluntary savings account and we never move out of that to the kind of insurance and security that informal workers need? And that's what worries me. And I think that as much as Melis says, this is a practical starting point, and I can see it amongst organizations of informal workers ourselves, I think we also have to be bolder about how we create social protection for informal workers as well, and how we create that security. And there are, there are examples going back to the 1950s in India, for example, of workers' welfare boards, which are financed by a small worker contribution, a contribution by the state, and say the lead firm in a construction chain. It's not necessarily that there's a formal employment relationship there, but you are actually getting contributions from other actors. The questions we need to be asking ourselves is, informal workers do not exist separate from the economy. They're in economic relationships. And where and how can we draw on those economic relationships to help finance some of the social protection? Because informal workers' savings are not going to be enough. The state subsidy potentially could be enough, but it's not going to be everything. Who are the other stakeholders who are going to be contributing to these forms of security we need to be building? If we take seriously the idea of informality as the way labor markets are structured, and we need to accept that, we have to take into account large levels of self-employment. And actually, we need to change our ideas about what kinds of economic relationships we can draw on to finance social protection. And that needs to be part of the mix as well. Perhaps there are other stakeholders in the chain that we can look to. But I do think, if we're talking about social protection, that's something, it's far in the future, perhaps. But I think it's the time to have bolder visions about how we're going to create security for this huge number of workers who are without it. And we saw the consequences of that during 2020.
Thanks for that. I don't know, Regis, if you also wanted to jump in on that discussion. Otherwise, I can also go on to other questions, but please.
Yeah, I think I'll be repeating what they said because I agree with all of them. You can go ahead on other questions.
Sure, let's do that. I have two questions here that I think are both Well, one of them is directly addressed to Laura, and the other one I think Laura also wanted to pick up. So it's your turn now. But the others, of course, are also allowed to answer. The one question was, what's the best strategy to adopt in targeting self-employed workers who do not belong to associations, if there are some experiences? And the other question was looking for a suggestion for Indonesia. Today we have 74% in informal economy, of which 24% in farming, individual farming with only small lands. How and what should be prioritized to become more effective to reach better coverage and sustain that? I think that is also a very broad question that maybe anyone from the panel can jump in on.
Thanks, Silas. Those are very broad questions. I think the targeting self-employment, I mean, it depends which kind of labor market you're talking to, because if you're talking about a labor market that's 80% self-employment or 75% self-employment in Africa, you're not targeting much in that case. I mean, that's almost everybody of working age is in self-employment. But I do understand the question of, how do you find these informal workers? And I'm sure Melis will have ideas as well. A couple that we saw from COVID was on-demand registration. So actually, saying, are you a self-employed worker? Come and register. And I mean, I think that's what's happening in India right now with the big registration portal that's going on is workers are actually being asked to come forward and register on the state systems. And then during COVID, I mean, in some countries like South Africa and Namibia, for example, we saw this idea of targeting out, right? So if you were in formal employment or if you were receiving social assistance for unemployment or for other reasons, you were immediately targeted out, and then everybody else was able to apply for the social assistance, and that caught a lot of the self-employed informal workers. But again, that system only really works when your labor market, has a significant amount of waged employed people in it that then allows you to pick up on the self-employed or the unemployed. But those were a couple of examples we saw from COVID. Again, it's all very dependent on context. Indonesia, I mean, that's a very difficult one to do now on the spot. I suppose, the idea is, what are the basic protections that need to be put in place? Is it, this health, pension, maternity benefit? I know for many informal workers, those are the kind of three things across the life cycle that are really important. So building on those. And then I know that Indonesia has some good social insurance schemes. They have the JKN health scheme, which does a good job of coverage, but I know provides is still putting quite a lot of financial strain on poorer informal workers. So the idea there might be to raise the eligibility for the free subsidy to healthcare. That might be one way. I mean, the JKN is a really good example of a scheme that mixes both social assistance and social insurance, right? So here's the thing you could do is just raise the eligibility for the assistance component of the JKN. To ensure that informal workers are less burdened by the cost of the contributions. And then it would be about, I guess, thinking through that for the other insurance schemes that exist in the country. But that's a very decontextualized suggestion. Thanks.
I will very quickly pose one very, hopefully brief question to Regis, because it was a very specific question raised in the chat. And while we have someone from Rwanda here, that would be, I think, interesting. There was a question, is there anything or should there be anything to particularly address for the new kinds of informal work in terms of, or is it, well, the new kinds of gig work, I should be saying, excuse me, in terms of ride-hailing drivers, and how do you address that gig economy, the digital gig economy?
Yes, thanks, Silas. I think Ezra is targeting anyone in the informal sector, being in any form of association or any type of economic activity, including that group, because we know that particular group is not covered. So we are facilitating them, giving them options to save for their pension. So it has been, in the beginning, the low-hanging fruits have been associations, cooperatives, workers' union, but we are now working with the telecoms to put up systems that are appropriate to self-employed. When you do transactions on mobile money, can you opt in to have automatic savings as you transact, commit a small amount of money that you keep saving over time? And I think those people will be able, in the long run, to realize that they have been making savings. But this question was also referring to social protection particularly, and I was answering in the chat the social protection products that we have. But even beyond social protection, because I am afraid this group of people might not be eligible because there are criteria that are related to the economic the capability of the person or the household to benefit from social protection, which, by the way, if they fulfill those conditions, they can receive small grants that they will be paying, or small loans that they will be paying over time. But if you don't fit, there are other schemes that help people to develop entrepreneurial activities, accessing finance, accessing, covering some of the collateral that the banks are asking them, and that kind of accompaniment that go with it. So I think the focus is on young population and women, and I think in Rwanda there are schemes for that. But for social protection, there are 3 products that I enumerated: direct support for people who can't work because they are old, because they are disabled, and there is public works, so people who have physical strength, so they can work on public works and get paid at the end of the month. And those small loans that people who can think about small projects can benefit and be able to develop themselves. I hope I answered to that question. Over.
Yes, thank you very much. I would like to then briefly wrap up the discussion. We don't unfortunately have time for more questions at this point. You will see in the chat links to different resources that were posted to the reports that Laura co-authored, to the report that Melis authored, and also Regis posted a link to some information on the Ejoheza scheme in Rwanda. You will find the presentation slides. We will share them after the meeting. You will find them online on the event page. I believe they will also be emailed. So thank you, everyone. I think this discussion has been really interesting, even for someone like me who has really been working on some of these issues for years and already has seen a lot of country examples, but I still think there's still room for new innovations in terms of incentives, in terms of facilitating and simplifying access to some of these schemes. I think we learned a lot in the COVID pandemic about practical delivery systems and their importance, about practical incentives and their importance for really rapidly scaling up some of these schemes. I think that should be taken forward for all of us and to learn from. Then I think some of these more fundamental discussions on voluntary savings accounts and their place in the compared to social insurance, and I think also a very interesting discussion of when we start with one system, do we set in stone for the next decades what the system looks like? I think some of these discussions will continue to be in our minds going forward. So I thank you all very much for this interesting discussion, for all of your questions and inputs in the chat. And I hope to see you all soon again. Thank you very much. Bye-bye.